Policy Talk. We've gathered here for a special talk series with Tikender S. Panwar sir on the role of local government in disaster, organized by the Center for Habitat, Urban and Regional Studies, IMPRI. It is my privilege to introduce the panelists. We first have a moderator, Mr. Tikender S. Panwar sir, who is a former Deputy Mayor of Shimla and a Senior Visiting Fellow at IMPRI. Now, if we introduce Dr. Elamon sir, he is presently the Director General of Kerala Institute of Local Administration. He is a medical doctor with a Master's in Public Health and has done his MBBS. His areas of interest and expertise include decentralization, local governance, participatory planning, monitoring, evaluation, climate change development, capacity development, institutional development, and knowledge management for development. Dr. Elamon was one of the core team members of the People's Plan campaign in Kerala when it was launched in 1996. Later, he served as a Chief Program Coordinator of SDC CapTech program, which was Capacity Development for Decentralization in Kerala, at the Swiss Agency for Development and Cooperation. Subsequently, he became the moderator of the decentralization community and maternal and child health community of the UN Solution Exchange of the UN country team managed by the UNDP, and also held the additional charge of maternal and child health community. Dr. Elamon served in the Intercorporation Social Development India as its CEO and as the Senior Advisor Local Governance in Governance, Decentralization and Peace team of Helvetas Swiss Intercorporation. Later, he was a core team member and technical advisor for the South Asia Climate Proofing and Growth Development Climate Change Innovation Program. He is also a member of the Strategic Academic Advisory Board of School of Governance and Public Affairs, Xavier University, Bhubaneswar, and a member of the Research Advisory Group of Integrated Rural Technology Center, Kerala. Dr. Elamon has successfully completed a course on climate change and health at the Institute of Public Health, University of Heidelberg, Germany. He was a National Resource Person of the Ministry of Panchayati Raj, India for Decentralized Participatory Planning. Dr. Elamon has also served in many committees set up by the Ministry of Panchayati Raj, India and Government of Kerala. He was earlier included in the UNDP Democratic Governance roster of experts in local governance and local development. Dr. Elamon was also awarded the Outstanding Community Builder Award by UNDP India in 2007. He also serves as a former Vice President of Kerala Sastra Sathya Parishad, People's Science Movement, the State Convener of Jan Swasthya Abhiyan Kerala, People's Health Movement, and President of the Kerala Sastra Parishad, Delhi Forum. He is also a member of the Syndicate, Senate and Academic Council of the University of Kerala. It is an honor to have you with us, sir, today. I would now like to request Tikender, sir, to take the session forward. Thank you.
Thank you, Kashish, for such a nice introduction of Dr. Joy. And yeah, so we would like to hear more from Dr. Joy, but just to contextualize this discussion and also to remind some of our participants and viewers who are there live on Facebook that after Dr. Joy finishes off his presentation, then we can actually go for some discussion. And those points of discussion can be generated either here who are participants in this discussion or on the Facebook Live. So we'll be able to extract some of those questions from there as well. So yeah, so welcome Dr. Joy into this program of ours, which we call #LocalGovernance. And Arjun will correct me, I think this is our fourth in the series. We just started this series. Why it is important actually to understand the role of local bodies in disaster mitigation, disaster adaptation strategies, is not just that it is part of our international commitment and the Sendai framework that we always quote, which speaks about measuring the disaster actually to understand what form and what in what form can disaster strike us, but also to further build our adaptation and mitigation strategies. Why it is important to hear somebody from Kerala, because Kerala has been an astounding example, I would say, against what we witness in different parts of the country, including my state that I come from, Himachal Pradesh. And the pandemic is, the COVID pandemic is actually, has actually exposed the kind of resilient strategies that we've always been talking about. Now, why it is important? I think it is important also because of the fact, because during the pandemic in the last 1.5 years, we were able to witness the PM always on the screen, the chief ministers are always on the screen, the DM was always on the screen, but we did not find the local body representative, the mayor of the city, or the local body representatives, be it the panchayat, the district panchayats, or the block panchayats. Now, why is it so? Despite the fact that we have different reports from the United Nations, if we have to quote internationally, that in the first 3 or 4 months, 95% of the cases actually emanated from the cities. Actually, so the first response while meeting this disaster was bound to happen from the cities. Of course, some cities have done phenomenally well. We've seen how they have actually been able to really intervene in this disaster. But by and large, we've seen the cities have been completely absent. So why is it? So that's the first thing, Dr. Joy, I think you should actually try to understand and try to uncover how this has been actually met with in Kerala. The second part is, and this I go to the Disaster Management Act manual, which I think needs complete revision for the simple reason that you have this connection, the PM, the CM, and the DM. But when it comes to even some of the cities who have been able to create the city disaster management plan of actions, what we call the CDMAs, or further some of the disaster, or have been able to draw their atlases as far as the disaster mitigation plans are concerned, those are not ratified. So, if there is no ratification of those plans, for example, the City Disaster Management Plan of Action, then it's just a mere document which actually licks the trash bin. I mean, there's nothing more than that the document does, despite the fact that the document gets created after lots of exercises, after lots of actions, interventions from experts, from city representatives, and we talk about shouldering that responsibility, but at the end of the day, those are completely minor. So it ultimately falls on the district magistrate or, of course, the chief minister at the state level. Why is it so? How do we break it? And I think we need to break it if we have to actually understand, because these disasters are not one in isolation. Actually, we must be prepared for more in the offing. So, and the best ways and the best resilience strategies is to actually adapt our communities, our structures, the structures that we have created. Over to you, Dr. Joy. How Kerala was an astounding example for which you have been awarded internationally. We've seen how your health minister was awarded, but I think at the bottom of everything, there was the local governance. Actually, we've seen the local communities, how interestingly they were part and parcel of this larger strategy. So I think over to you, Dr. Joy, and we look forward to your presentation.
Thank you, Dr. Arjun. Thank you, Kashish, and thank you, Tikender. In fact, we should have interacted a little more, knowing each other before all these things, because I know you in a different capacity. You are past. Okay, I'll start with that. Thank you for this opportunity. See, I mean, I will start from where Shri Tikender Singh Panwar had stopped now. Basically, you moved up to the COVID scenario, and things happen at the local level. So that's from my start, but it's not about COVID. I'm actually trying to say it's all about disasters itself. So as usual, we will also go for this PowerPoint, because that is also part of any talk nowadays, so that also it's more visible and you can actually understand better. So what I'm trying to talk is about role of local governments in disasters. So that itself is slightly problematic, So you're actually talking about role, but it's actually beyond that, I would say, if you are taking about the actual, because you have been, I mean, the Tikender has been a mayor, deputy mayor, which means you are part of the local government, and then say it's not just about one role of the local government, it's part and parcel of any local government function. It's a part of local governance actually. So it's not just about role. I mean, putting it like that. Anyway, I don't go into all those kinds of things. Is this visible now? Is the PowerPoint visible?
Yes, sir. It's on. It's working.
Okay.
Yeah, it's visible.
So, yeah. Okay. So this is it. And what usually happens in the times of disasters? See, first of all, it's an emergency. I mean, it's emergency means emergency. And we all talk, it's a war-like situation, a war situation. I would say it's a war-like situation. Okay. And then if it is a war-like situation, a war, then deal it like in a war. And there you need to have coordinated efforts. Say in a war, you need to have it in a coordinated efforts. And at the point of a disaster, the uniformed and the non-uniformed forces come together or have to come together. Uniformed, you know, the police to the fire force to all kinds of people, the military and all kinds of people come in, and also the non-uniformed forces, all those officers and activists. I mean, everybody has to come together. So it's like that. And there should not be any confusion at that time. There should not be any miscommunication. And the roles have to be very clear. And in such a situation, a single point of command is what is advocated. And single line of communication. So basically the approach in times of disasters, the theory talks about it, the concepts talk about it. It's a command and control kind of situation. Okay. But then our system is also developed in this context and this pretext that it's a command and control system. It has to be done, the single command system and all kinds of things. So we have the National Disaster Management Act, which is exactly based on this one. And the National Disaster Management Authority with the Prime Minister as the chairperson, so that everything can be coordinated well. And then the State Disaster Management Authority with Chief Minister as the chairperson. Okay, this we can actually see in the context of COVID also. See, COVID started as an endemic, the epidemic in Wuhan, and then it became a pandemic. We also declared it as a pandemic, but the WHO declared it as a pandemic. But then after that, we declared it as a national disaster. And then the entire thing is managed at the PM level or that in the states. If it's a disaster, then it's a State Disaster Management Authority. It is no longer a health problem. It's no longer a health problem. That is it's a disaster. It's managed differently. So you have the District Disaster Management Authority. See, District Disaster Management Authority chairperson is the collector or district magistrate or deputy commissioner. Each state has a different name to that as the chairperson. And an elected representative of the area is a member of the DDMA, which means for a district panchayat, Jilla Parishad president could be an ex-officio member of the co-chairperson. See, it's a co-chairperson, which is actually equal to the chairperson. But you understand how it is happening across the country. It is there. As elected representative of the area is a member of the DDMA as an ex-officio co-chairperson. And your district magistrate is or district collector is the chairperson, means this co-chairperson is also a chairperson. That usually is forgotten. Okay. But then when you're talking about the disasters, who can actually really do this in your state? This is what I'm trying to ask. What happens in a disaster? Who is the first respondent? Himachal would have faced, or many other, I mean, I'm not talking to you alone. So to all others, who is the first respondent? Who knows the area? Who understands the community? And community understands whom in a disaster? This is more important. And there comes the local. And so what happens? You know who is the first respondent. When the first respondent is the people living there. When all of us come very late. And even when it happens, the people who know the area are the people from that locality. And who understands the community. And the community understands the local people. So this is how it is. So you had the command and control system, agree. But you also have to think in terms of this kind of thing. And we also have, as part of all this, this thing, NDMA and other things, we have the National Disaster Management Plan, the State Disaster Management Plan, and every district has to prepare the district disaster management plan, where it is also mentioned that after consultation with the local authorities and having regard to the national and state plan, and to be approved by the state authority. I'm just trying to put in whatever is available in the act and the all other things. I'm not talking anything beyond that. And when it comes to the district disaster management plan, I've put all those red ones to highlight wherever this, every section, every clause has a local authorities, local authorities, local authorities. Whether it is in capacity building, whether it is in the prevention and mitigation aspects, I mean, beyond the district. But usually the beyond the district do not happen. This is the practical, I mean, the actual reality across the country. I mean, here and there, especially in some corporations, the cities and all, some plans are developed, usually supported by some agency and other things. But generally, this is how everywhere these local authorities have been mentioned. In fact, even if you look at the disaster management plan itself, every office of the government of India and the state government at the district level and local authorities shall, subject to the supervision of the district authority, prepare a disaster management plan. See, I have again put that red one there. It's the local authorities also. And where does that happen? I mean, this is the question. Usually the disasters are considered as the command and control system, where your revenue authorities, the district, so-called district authorities, do all these things, and not to the local level. This is the actual practice we have. Sometimes it is done excellently, but generally this, I mean, excellently by the district authorities or other authorities, but it's all centralized. I mean, but then this is the situation. So where is the local government? Even there, you have only mentioned about local authorities, but nobody has mentioned about the local government, because people have forgotten that there was a 73rd amendment and the 74th amendment. When you draft your next and next and next legislations act, why do you forget that? Usually a new amendment or a new act or new legislation comes based on the previous ones. You can't ignore that. So there is a 73rd and there is also the 74th amendment. And then when you come to the act here, you miss it. This local government word is missed. You put it as local authorities. That, because actually the country has 3-tier system, I would say. We have the national government, you have the central government, you have the state government, and then the 73rd and 74th amendment actually has made it a 3rd tier of government, which we forget. That is why we still continue to have this local authorities rather than the local government. And local authority, and thankfully, they also mentioned that it could be Panchayat Raj institutions, municipalities, the district board and others, and the Jila Parishad and all. So this is also there, which means they have to prepare the local disaster management plan. And responsibilities where it is all mentioned. Local authority should ensure that everybody is trained in disaster management, maintain resources related to disaster management, and local authorities should also ensure that the construction of project under its jurisdiction conforms the standards and specifications of the national and district authority. So this actually, if you go by the existing act itself, there is real role for the local governments. That is the fact. That's a fact, but which is never understood. That is why earlier I mentioned, when that co-chairperson is mentioned, nobody has told any district or Jila Parishad or district Panchayat president that you are also the chairperson. He or she won't get any letters. He won't, I mean, most of the places, I'm saying most of the places, nobody, even they themselves do not know that they are the chairperson there. This is the fact. And no local government knows that they are supposed to prepare this disaster management plan. They are supposed to do, and whenever they prepare any projects or anything, they also should consider the disaster aspect of it. That's also there. So this is what I wanted to emphasize actually. So local authority should carry out 3 R's, they say: the relief, the rehabilitation, reconstruction, and all those things. And see here, this is the question. See, prevention of, there is a prevention part of it. The disaster management includes and it's a continuous and integrated process of planning. So it's not a one-time this thing. Whenever there's a disaster, somebody is going to manage that disaster. That is how it is thought. Usually happening is that whenever there is a disaster, you start going and doing it. It's a process of planning, organizing, coordinating, and implementing measures. It's about prevention of disaster also. And it's also about mitigation or reduction of risk. And there it's also capacity building is there, preparedness is there, prompt response is to be ensured, assessing the severity and effects of this thing, evacuation, rescue and relief and rehab, all kinds of things which you typically talk about in a disaster management. But I am trying to say it's right from prevention and mitigation and reducing the risk of disasters. This is where your panchayat plans or any development activities in a panchayat or a municipality or a corporation becomes important. When you do something, you need to also consider in that context of the disaster management plan, where you have to think about the prevention, think about reducing the risk and all kinds of things, which usually do not happen. And this cannot be done at the centralized level. It can only happen at the local level. I would actually take you to a MGNREGs of the, when you call the Narega kind of thing, where a lot of activities happen on land and water. And that is where you can actually do a lot of things in disaster risk reduction, or you can also increase the disaster chances. The chances of risk of disaster can be increased also if you do unscientific interventions through MGNREs also, because you are working on land and water. When all kinds of things. So everywhere you need to have this disaster proofing done, and that can happen only at the local level. This is my contention. So we also had the same system. We also had a revenue department based disaster management activities everywhere. And it is that at that time that the revenue comes into the picture. But in 2018, we had a massive floods. Most of you would have heard about it. A massive floods cutting across almost 11 districts out of the 14 districts flooded, and all the cities, towns, everywhere had happened. And we had never faced that. Only 100 years back, we had a similar kind of situation. That is what history talks about. And then really what happened? The slide which I showed earlier, who are the first respondent? It's the local people. It's the local authorities or the local panchayat or the local municipalities, the elected representatives. I would actually usually say when they start in the night, actually it was announced in the night that there is going to be the chances of flooding there. All these elected members and the officers of the local government started walking and calling people out and taking them off and other things. By the time they returned, their own houses were flooded. But they were there to really literally evacuate people and other things. And then what happened is that only after 1 month or so, they could actually come back and see, because then they had to do also all kinds of rehabilitation, all kinds of shelter management, all kinds of things. And then all these people had to, when they came back, they also had to look into their own affairs in their households. So this is the way the local governments and the elected representatives and the officers there responded to the 2018 floods. And that opened the eyes of people. See, because at that time it was heavily flooded, and then even those who are coming from outside, they didn't know where you are. And then it's the local people who actually guide them when all these rescue measures are all there, but they cannot simply come and do anything because people don't know where you have to go, where the people are there, where the elderly people are there, where somebody is sick, where somebody has to be evacuated, where is the problem. All these kinds of things only the local population knows, and the leaders of that local population is the local government people, the elected representatives. See, this is how it happens. So that's why I said, and also the local authorities or the local government people are known by the community that also makes it easy, and they know the community also. That also makes it easy. So this is how actually the things happen. It was not part of any rule. It was not part of a legislation. It was not part of any such directions. They had to act. They acted because they are the first respondents, and they are the local government people. And I also usually add one more thing. I mean, might not be that relevant for many of you, but there was a second round of flood immediately after the 2018 flood, which people don't know in Kerala. That was a kind of flood of grievances. So many people have lost things, and then they had to approach people and other things. And technically speaking, as per all our rules and regulations, it's all the revenue and other departments which are supposed to take care of it. The local government, the panchayats, the municipalities don't have any role. That is the situation across the country. In a disaster, post-disaster, it is actually through the district authorities and all that the things happen. But then this second flood of grievances, second round of flood of grievances or complaints or whatever you call it, that flood actually flowed into the panchayats, the municipalities, the elected representatives' houses, elected officers and other things. Why did people go there? They went there because our 25 years of People's Plan campaign had made all these local panchayats and municipalities and others as local governments. See, that is why people understood them as their government at their doorstep. This is exactly what happened. When we started the People's Plan campaign, there was also this all questions about why decentralization. It's a different agenda altogether. It is actually government withdrawing, trying to withdraw from, that era of 90s and all, where people withdraw from the governments, the state withdraw from all this social welfare and other activities, and it is given to the market. Whereas we had a different approach to the entire thing, where we said it's not like there is no alternative. The TINA syndrome, we said we have a TIA syndrome, where it is there is alternative. Taking decentralization as the approach, but in a different way, and say governments not withdrawing, but governments becoming more closer to the people. And here you have, in 2018, you find government is just at your doorstep as local governments. And people understood that, or felt that this is our government. This is how I place it actually. And this is exactly what should happen for any disaster and any other activity. So we had a new working group. Suddenly we have this, some of you who are into this local government planning and other process, we have now the national government also has declared People's Plan campaign. From 2015 it started, and then 2018 it was named as People's Plan campaign itself. And then there are also working groups and all. So after this 2018 disasters, we had one more working group formed, because otherwise it's a thematic oriented working groups. But we also had a separate working group on environment, biodiversity, climate change and disasters. So which is all interrelated kind of thing. So this is for this. I'm just trying to see, initially I talked only about the legislation part and the theory part of it. Now I am only giving a short, a case study kind of thing. I'll take 5 more minutes and then we'll go for this thing, just for understanding how it really happened.
No, please go ahead, Dr.
Yeah, okay. And hope I am making sense about this one. So this we had, and I would say good practice. So we decided that all Gram Panchayats, municipalities and corporations to prepare a disaster management plan. Shimla, you had already prepared a disaster management plan, but then you also mentioned that it is yet to be approved. That's what you said, I think. I mean, I'm talking to Tikender Singh at the moment, not to the entire population. But then, but here, how it happens, I will tell, they all have to prepare their disaster management plan. There is a Department of Local Self-Governments provided the framework, template and guidance. Kerala State Disaster Management Authority provided technical support. So convergence, actually, people coming together kind of thing. And KILA, where I am working now, it's a training institute. We did the capacity building and coordinating role in it. Okay. Who does it? Actually, it is done by the local government. We have the steering committee at the local government, they do it. And this working group, they do it. And it's also that all other working groups also have to join. See, disaster management is, as you would see, is not a separate parallel process. It has to be part of your development itself. This is what I try to do. And this has to happen together. And so all other sectoral working groups and departments also have to join. And then there are the volunteers and all the typical things which I'm talking, including the Kudumbashree, that is the women's self-help group network of this thing. Almost 2.5 lakh people in action just to prepare this thing. And the phase-wise cascading trainings. I mean, that's all are the typical things which they prepare. But interestingly, till that, people always talked about the lack of data, lack of information, and all kinds of things. But the Kerala State Disaster Management Authority tried to collate all the data required for such things and provided 31 layers of maps to every local government, which means if I am from a particular Gram Panchayat, my Panchayat gets my Panchayat map, 31 layers of map with various. I will show you some of them so that then they know what they are up to. And they had to do a little bit of analysis of data collected and the maps, but not very scientific, highly strong academic exercise and all, but what the people can do kind of thing. And then they came up with the suggestions for a disaster management plan, discussion in the Gram Sabha, and a special development seminar and a disaster management plan. Here, what happened is that we started in 2019, 19 towards the end. The training programs and all were in December, and by January, people started preparing it. But then, by that time, this COVID thing had stuck. So people could not complete it in that way. Some of us, around 300 of them did it very well, but others also did it, but they could not do it very properly kind of thing. But the thing is, that disaster management actually plan helped them while managing their COVID. At that time, people didn't have any idea about such a pandemic as a disaster, but still the plan prepared could actually, they could actually use them, because basically it's about disaster kind of thing. And another thing which you have to do is actually incorporating some of these elements into the Gram Panchayat development plan. And when I say GPDP, it's also about municipality and corporation. Integration of the DM plan into the Gram Panchayat development plan, because it's also about mitigation, it's also about development. It's not just about when a disaster happens, you do something. Okay. And actually how it is done, DM plan is sent to the district planning committee. It is vetted at the district planning committee and then the district level. That didn't happen actually. By that time, we were all into the COVID thing and those things didn't happen. And finally, these were sent to the district disaster management authority. And when they prepare their district disaster management plan, these things have to be incorporated there. So when silently we actually got the local government or the local plans into the district disaster management plan kind of thing, usually prepared by the district development authority. And what does this contain? A local disaster management plan. It's about mitigation, preparedness, rescue, relief, everything would be there. Responsibilities will be there. Who should do what? Projects to be included in the GPDP to prevent disasters or reduce risk and other things. In fact, I would also have to say that we are also into another project by the KILA. We are actually looking at ecosystem-based disaster risk reduction as another methodology, which using MGNRGs. We also have the Urban Employment Guarantee Scheme. That's the state government has a Nayangali Urban Employment Guarantee Scheme in the similar lines of the MGNRGs or NREGA. So all these things, we are also trying to see how this ecosystem-based disaster management can be, disaster risk reduction can be applied through MGNRGs or our Iyengali Urban Employment Guarantee Scheme. Anyway, that's about it. So some of these things have to go into your GPDP, some of the things have to go into your NREGA plan, action plan, and suggestions to other tiers of local governments, because a Gram Panchayat alone or a municipality alone cannot deal with a disaster in mitigation or action. So you need to say some of these things we do, some of these things the others have to do, some of these things the district authorities have to do, some of these things the state authorities have to do. So this is the kind of thing. And we also, every local government formed emergency response teams, 4 teams actually in every local government. Actually the second round of trainings are happening now online only, where one is on first aid, one is on early warning, one is on rescue, and one is on shelter management. So at least 10 people in each of them, and they are provided training and all. So every local government now has started having this kind of settings. And I will actually just show how the maps look like. And every panchayat or every municipality got these maps. Say, for example, this is earthquake map. The next one is the flood affected area, 2018 flood affected area map. So here you can see it's only in one small place in that. This is about a one panchayat only. This map, this Avanur Gram Panchayat in Thrissur district received this map. So they have almost 30 layers of maps like this. And the one you see in the left side, this side is the earthquake related. Second one is the flood affected related. Another one is on a communication map. Another is the drought proneness map. Flood affected area 2019. We had another round of flood, and there you can see this one. Flood proneness versus the land use map. And it's actually an education process, I would say, the community education process, I would say. And this is about flood proneness versus the communication map, flood proneness versus the infrastructure facilities map. So these were all provided by the disaster management authority to each of the local government. Is the great thing, I would say, as an achievement. I would say that is the major, because usually the data is never shared by anyone. So this is what happened, and it is going up to the local level. Flood proneness versus transportation, satellite map of your area. I mean, you can see all these things. See, such maps are provided. That's my point to make. I don't take too much time. I mean, so because why the transportation map is important is that evacuation requires that, or we have even water kiosk mask map so that you know where it is, and like that. And this is the structure and templates and other things about. And chapter 1 is about general information and all. I can just see how it is. Usually the typical chapter of all these things. And then disaster proneness and analysis map. Based on that map and all, disaster prone areas are identified maps, and also the data also they can collect. Chapter 3 is about disaster response plan, where details about the teams to be formed for the coordination and other things. Then the preparation, mitigation, and social empowerment. Here also again, all those kinds of things have to be there. It's the capabilities, the resources and tools to be made available during emergency situations, skilled and unskilled human resources required, tools needed for an emergency, all these things, where it is available, and all those things are there. And the chapter 6 about climate change adaptation, disaster risk reduction, project suggestions. Project suggestions to be included in the GPDP, project suggestions included in the higher tiers of local governments up to the state government, project to support disaster risk management, mitigation, adaptation, suggestion to others, and all kinds of things. And chapter 7 is about all the names, addresses, this, that, all kinds of where it is available and all kinds of things. This became very useful for our COVID situation, okay, in the initial stages. So this is one of this thing, and this is the Nadmudi Gram Panchayat. It's in Kutanad, which is water prone area. So there it is. So this is how they prepared it. This is the stage where we are in. So what I was trying to say was that if you have understood what or if I was able to narrate what exactly happened and how it happened, I think you would also understand that we need to have the local governments in action for any disaster preparedness and management and disaster risk reduction and mitigation as well as adaptation kind of thing. So this is how we have to move forward. So I would actually conclude at this stage. I started with that managing a disaster is an emergency situation, warlike situation. You have to do it like in a war, and then you have to be a coordinated one, and then you have to be the command and control kind of thing. To the second part, where who is the first respondent, who knows the area, who knows the community knows whom kind of thing. And finally, as part of development, it happens from the local level, how actually the development can also be included, so that you move into your planning at the local level with a disaster kind of thing. So this is, I would say, you can call it role of the local government, or you say just local governance in disaster. Right. Thank you. Thank you.
Thank you. Thank you, Dr. Joy. I think it was wonderful watching your slides and also watching you speak about the actual practice of management in the disaster. But then, as they say, actually, it's the disaster that teaches you how to manage the disaster. So, and probably the Kerala floods were one of them. But I think underlying one basic fact, which is also very important, is that the people's plan, the contribution of the people's plan, and commitment for understanding that local governance is part and parcel of the larger governance tools that we are talking about. So Arjun, I think before I just have two issues to flag here, Dr. Joy. And the first one is I was really fascinated to see those 34 or 35 layers in a panchayat. So who does the capacity, because we can understand what we call the quantitative and the qualitative data. So we can understand, the primary role of the people, but at the same time, we require experts. So, and this is what Romy and we've been discussing for long, in fact, and probably we can see some ray of light through your discussion. We just do not want to restrict it for the disaster management plan of action. But what we have been discussing is, and I want you to actually speak on that, is also to contribute to the development of the master plans of the regions, the land use master plans. For the simple reason, when the same people can contribute in the formation of, and this is what you have also been mentioning, about mainstreaming the DRR or, integrating the entire process of city development plans. So what would be the role of the local people when you create these master plans? Because, these master plans generally are being drawn by consultants, by parasitical organizations, and then never owned by neither the local governments nor the people. So I see that ray of light. I mean, that's one part. But I think the first thing also you have to answer, I mean, who did that capacity building? Bringing those layers, the 35 layers, but fascinated further. The second thing is, and that comes out from sheer practice, Dr. Joy, is what if there is a contradiction going in between and I talk about the district magistrate and the co-chairperson, the district panchayat chief. So how do you resolve that? Or has that ever happened in the history of, and I'm sure that much should have happened. So how do you resolve it? So who takes the call, or does the call finally lie with the chief minister, because the chief minister happens to be the chief of the state disaster authority. So, I mean, all those intricacies, how do you really respond to that? And but overall, I think it's a fascinating, and it is also important for the rest of India to learn from the experiences. And Dr. Joy, also because I was called by the NPDRR, the National Platform for Disaster Risk Reduction, here to speak immediately after our Home Minister spoke. And because Shimla was able to create its own atlas at the ward level, that was one of the finest work that we were able to do. But the problem lied, and actually you have really tried to bring in the concept of praxi, and how in practice the problem can also be resolved, lies in the fact that we need to really restructure the Disaster Management Act as well, where we have to empower the local governments. In fact, in the structural discourse, which unfortunately still lies with the bureaucracy at the local level. So, and we've seen this in the Central Vista, where the CPWD also becomes a local authority. I mean, it was quite astonishing for us to note. When the maps were to be approved by the NDMC, so they said, no, CPWD can also become a local authority. So, that overplay of words and overplay of interplay of forces, that's how I think that is what we need to put an end to. So overall, very fascinating. Thank you so much, and I think it's a great lesson for other parts of the country, especially our. All those who are really wedded to local governance and democratic decentralization, empowering the people. I think over to you, Arjun, and then Dr. Joy can respond maybe selectively to all these questions. Yeah.
Right. So just very fascinating. Also, sir also showed us all the maps and all also. Taking cue from what Tikender sir really highlighted. So district as a intervention at the local level? How do you see? Because in some district, for example, Delhi has, 9 districts. So sometimes the local government falls into the ambit of various districts. Sometimes in one district that is huge. How do you see the conundrum of local government, especially from the disaster point of view and the district administration? That was something I just wanted to add upon this. I will also add one more aspect there, that for especially disaster and emergency scenario, do you also have some practices on the financial management part of project planning or project execution? Because the fund flow and other things also changes as the resources are limited.
Okay, shall I? Okay.
Yes, sir, go ahead.
Yeah.
Yes.
So I will start from that map and the capacity building, the right question. See, I mean, that's why I said, usually this data, information, maps and all are never shared. All the agencies keep it for themselves. If you ask in any meeting, oh, we have that data, but you won't get it. When nobody shares, even within the government, within the system, people don't share. That's the system. But here, this case, Kerala State Disaster Management Authority was able to pull together every information, and then these maps they were willing to share. That was for the first time. So I won't even go up to the capacity of people to even look at the map. But I would say the achievement is that finally these maps have come to the place where it should come. Okay. And it was given on a pen drive and to everyone, and it's also available on our website. I mean, the KILA's website has every map there. But then the second one is, I mean, we did the training programs. I mean, KILA, but I would say we have not reached all those stages. See, some of these panchayats by themselves could just understand something, that, okay, this area is going to be flood prone and other things, but they also have their indigenous knowledge that this is a flood prone area also. Sometimes they correct also. They see, this is not the place where see our real problem, something another. But these things actually give them an idea that we need to look at this area and the spatial dimension of your development activities. So it's a process. We just started. I would see, whenever I talk about Kerala, this is an issue. When it's not 100% state kind of thing, everything is done ditto like in a book or a presentation like here. So it's a different stages of development, I would say. So we take it like that. But we had these training programs. Some of them did it very well, whereas some of them still need to do a lot to understand. But the idea is that these are now available so that some people can actually look at it and say, no, you should not do this here, kind of thing. Slowly that, but when then we need to actually take it forward. This capacity building, the skill development and other things have to be taken it forward. How to read a map itself. And this is the problem with our data also. You say everything is available on the website or in your this thing, even if it's available, you need to have those data in an assimilable form by a local person. That is the way the scientists and others have to really do it. I mean, you can give me everything, but I won't understand anything.
That's important.
See, this is exactly our challenge. So this is why we just try to do this. That's the first one. Second one is about the co-chairperson issue. That is why we all talk. Slowly we need to actually say that, yeah, you are in command. You are also in command at least to slowly, but that is also depends upon the stature of your local government system in your place, in every person's place, because even though it is the 73rd and the 74th Amendment applicable to the entire country, see, we are on different stages of local government system. So that is an important thing, but slowly one by one, we need to literally move up. The third one is about district versus the local and other things. I have a notion that we are not talking about a totally decentralized structure. We are actually talking about multi-level planning. We don't do completely decentralized thing. We do multi-level. Every level, every tier, every authority has their roles, which we need to identify and define. And there, district authority also has a major role. And especially in disaster, we say, see, there are certain protocols and other things have to be developed centrally. But there are certain things which have to be done locally by the local, adapted to the local situation. So you can't actually deviate. For example, we are doing this COVID prevention activities. It is led by the local governments in Kerala, but bringing together every department and others. So everybody is active, but then overall protocol of how to do things is by the state disaster management authority. So we are talking about a multi-level. Whenever we say local governance and all, we are also talking about multi-level governance. It's not totally islands kind of thing. So that's a thing. And the fourth one is about your question on this financial management kind of thing, where one good thing with Kerala is actually about this People's Plan campaign, where the funds are transferred to the local governments, the institutions are transferred to the local governments, so that there is your development activities happen through the local government, and there you can actually disaster proof or do disaster reduction activities at that level. So this is the advantage where we have. So even now, when we have this COVID, the local governments can use their own resources which they get as the plan development funds also, and plus the SDR, state disaster funds and funds and other things, but they themselves also have the resources through their plan allocation and other things, so they can do it. And also they mobilize a lot of resources. When it happens at the local level, you mobilize resources like anything. We had the last year we had this when the first wave of COVID, where we had and lockdowns and other, where we had the community kitchens and various other initiatives, and the entire community, in many places, actually the community kitchen, they got all the resources, especially, need not be in cash alone, in kind, especially with vegetables, rice, and all kinds of things come freely, from free actually. So this is the way the local population can actually mobilize resources beyond what you have. So there are a lot of scope and potentials at the local level. So the financial manager, of course, there has to be that's exactly the issue when we have in our own country. The issue is about also this, when you have your activities and actions and responsibilities decentralized, you also have to provide resources also decentralized. So when you have your state doing managing disaster, there has to be also the support from the accord. That's how it is. But when we should not take that everything is absolute and it's over kind of thing. It's also a process for change. That's it. That's how I see it. Okay.
So Arjun, is there any other question, or shall we?
One question is there. TV ma'am is asking that, sir, waste is another disaster now. Do you think our local self-governments are aware about the necessity of managing waste, especially in this COVID situation? And are they equally efficient in this manner? Sir, let me rephrase this question to Kerala specific. So we all know that one of the issue because of the geography of Kerala is also of drainage. And the liquid waste management becomes a very important point. How do you see at the times of emergency or disaster? Is there any special focus on drainage aspects?
Okay, so this is also history, part of history. So when we had a long years of development across, so we also forgot the nature. We also forgot the spatial aspects of development to some extent. So our local governments are also trying to address these questions now. So our initiatives at the moment are more on to the waste management. Earlier, it was only the solid waste management, which was a major issue. But now people understand that liquid waste management also has become a major issue. So integrated waste management is the catchword now. And we are trying to address those issues also.
Right. So one last question from my side, and we are so thankful that Tikender sir is also here. Kerala, just at the Indian Ocean, and Tikender sir, Himalayas. Our country is so huge and almost a subcontinent. What would be your message of the local self-government, especially in this emergency scenario, for, let us say, people in Odisha, Northeast, Jammu Kashmir, Ladakh, other terrains of our country?
See, I would say, Kerala, I showed it only as an example we had just now. Before 2018, it was the same here also. So what I'm trying to do say is that the local governments have a role to play, and it's not just a role. It's they who can actually do it kind of thing. And so that's applicable to the entire country. See, there could be qualitatively, you would say this is better. See, what happens is finally, it's also about indigenous knowledge and skills and capacity. So, Kerala might do it in a particular way, when Shimla would do it in a different way, or Himachal would do it in a different way, Orissa would do it in a different way, but whole entire approach is about the local governance.
Yeah.
In disaster, local governance. So I started with local governments in disaster. I would say local governance and disasters would be the next stage of our development. So it's applicable across the country, across the world. And in fact, you go to the Sendai framework, you go to the IPCC, everywhere this local is written. But it's all different meaning to different people. I would say that. Yeah, that's it.
Great. And our government is also focusing on vocal for local. With that, Tikender, sir, over to you. Yeah.
I don't know what this means actually. But yeah, I think it was really a fascinating experience to listen to somebody down south, and actually also who have been quite instrumental into this transformation that is so pivotal for local governance. And we wish that in days to come, actually, because we've seen different models, and these models of city development, of building in those structures for city resilience are quite unsustainable. So I think there are multiple ways to approach this problem, and a disaster is not just disaster; it's part and parcel of the way we are building our cities. So with that, I think I would really like to thank Dr. Joy for sparing his time, and I know because still the pandemic is on and we have lots and lots to do. But yeah, the bottom line happens to be, and I think it is also a part and parcel of that evolving process which we are learning. For example, Himachal did extremely well as far as managing the pandemic is concerned. And Arjun, we did that exercise. You remember that Uttarakhand and Himachal, there were stark differences. So I think the different stories coming up from different states. But yeah, I think we are evolving, and at the end of the day, it is for how do we save lives, how do we save livelihoods, and of course save our environment ecology, which is also part and parcel of that larger disaster. Thank you so much. Thank you for joining, and we wish.
Yes, let me quickly propose a small vote of thanks. Yes.
Yeah,
so thank you, everyone, those who have joined here and on Facebook Live and will be watching later on YouTube and listening on our other podcast. So on behalf of IMPRI Center for Habitat, Urban and Regional Studies, thank you for joining on this our special talk series, #Local Governance with Shri Tikender sir. And today's deliberation on the topic role of local government in disaster by our distinguished speaker, Dr. Joy Elamon, sir, who is Director General of KILA Institute of Local Administration. Sir showed us various things, and I would encourage all of you to go through the website of KILA, that's KILA, KILA.ac.in, and all the resources are there. So it was really fabulous to have Joy, sir, enlighten us through all the good work the Kerala Institute of Local Administration and under the leadership of sir is doing. Thank you very much, and we wish you all a very nice evening, and please take care of yourself. Thank you. Thank you.
Thank you. Thank you. Thank you. Thank you.
Thank you, sir.